You welcome. This is Pinnacle Health Radio, and this is Earth Matters on the Wheel. I know wherever you are joining us, this is still the African #1 health radio station, and this is your program. My name is Samuel. Like you do know, is all about real-time health. My guest today is Dr. Abosede Lewu. She's an entrepreneur, and mostly she's a social African Nigeria. She's a blogger too, a youth enthusiastic, and she has over 10 years experience on adolescent-based issue with her interest and passion spanning back to undergraduate years. She has been involved in various seminars and workshops and addressing young girls and women, imparting them with knowledge and using her own resources, network, and skill to improve lives and community. Dr. Abosede Lewu is a MHDay Washington Fellow. She's a medical practitioner in obstetrics and gynecology, and she's the founder of the popular organization called Women Girls Aid Initiative, and she's the one I will be speaking with today.
I get wings to fly. Oh, I'm alive.
Hello.
Hello, all right. Hello, good morning, Dr. Abosede.
Hello, good morning. Okay. So you're speaking to Dr. Abosede Lewu, which I've heard you say already. I practice in the field of obstetrics and gynecology.
Okay.
And I'm the founder of Girls Aid Initiative. We're an NGO that caters for needs of young and teenage girls.
All right, thank you, Doctor. Yeah, yesterday it was about Menstrual Hygiene Day, and
Yes.
which we know that it's not a word that even strange to you. For people at home, what is really menstrual hygiene, Doctor?
Okay. So before I talk about menstrual hygiene,
Okay.
I'd just like to reiterate that menstruation is a normal biological process, and it's a key sign of reproductive health in a female child.
Okay.
Now, when we talk about menstrual hygiene, when we talk about hygiene generally, these are practices that are considered healthy, neat, appropriate, so as to prevent infection or any disease that comes from being unhygienic.
All right.
So basically, menstrual hygiene is like a group of care that you should have when you're on your menses as a lady.
Yes.
Yes. So then another thing we noticed is that the major problem we have around menstruation or the lack of the hygiene is because there's so much silence around it.
Okay.
And people have a lot of there's a lot of limitation on information, and then there is this scare tactic when parents are breaking the information about menstruation to their daughters. From some of the data that we work with, we found out that in Southeast Asia, 1 in 3 girls, they don't know anything about menses before they start. And then it was said that even in Iran or India, quite a number of girls think that menses is a disease.
Wow.
So the moment you find out that a child is thinking of something that is natural as a disease, it will affect the way they manage those conditions.
Okay.
So for us African parents, what is most common is that once a girl starts period, parents are really mostly concerned about now, you can now get pregnant. So what they come up with for you is, you are now menstruating, if a man should touch you, you'll get pregnant, and then, if you used to play with your male age mates, they start segregating you, don't go to that boy's house, don't do this, don't do that. Because, the most important thing to them is that, this girl is not capable of getting pregnant, we don't want her to be pregnant as a teenager. However, menses is much more broader than that. There are things you need to teach your daughter once she has reached that age. Now, another major problem is that parents don't even help their daughters or their sisters or their whoever is providing for that child to select the best product for them.
All right.
You don't teach them how to apply the product. You don't teach them how often they should use it.
Okay.
You don't teach them how they should discard the product. Now, these are the 3 things that majorly affect them. Now, for the young girls, because most girls start period at early age, between 11 and 14,
All right.
you find out that they are all in school at that time. But because we're not considering menstrual hygiene as a big deal, we don't know that the schools have a huge role to play in menstrual hygiene.
Okay.
For instance, I'll tell you that for a young girl, if you're starting your period sometimes can last for 7 days or 5 days sometimes. So in a year, that means a girl is menstruating 5 times 12.
Wow.
That is 60 days. So if a girl is going to be in school for about 9 months, then we're talking about 35 days. So that is a month. So if a daughter or a girl is attending a school, or you are even working in an office where there is no appropriate disposal of your menstrual product, then you start missing school or missing work. So that is how important menstrual hygiene is. So for us to know that if we don't put in all these structures down for both young women and young ladies and young girls, it has a ripple effect beyond it being a biological function that a lot of women don't know how to take care of it.
All right, doctor, thank you so much for that. I think I got a lot of questions here, but before I go that, let's look into what are the major tips, the hygiene tips every girl and every woman should know.
Okay. So for me, I think the first tip is to know that menses is natural. For older women, this is not a problem. But for younger girls, this is a challenge. Because I once had an experience when I was younger, when I had a friend that apparently they had been telling her at home that girls that menstruate are witches. I don't know where she got the information from. And then the day she saw her period, she started screaming. She wasn't a witch. She wasn't a witch. She was really running up. She was really hysterical. So the first thing is information. It is natural. It is not a taboo. Then another tip is that for a lady that is menstruating, I always say you have to take your bath twice a day, at least, if you don't do that normally.
Okay.
Your clothing have to be neat and dry. This is not the time you want to wear something very heavy or moist or something that just makes you feel generally uncomfortable. Okay. Now, after using the restroom, if the facilities are available, it's actually better to wash with warm water. And it is said that if a woman is washing with warm water, the best position is while she's squatting when she's on her period, because the blood can spill to the inner thighs. So it's better for the woman to squat when she's washing. Okay. And this is also a time to avoid using soap and vaginal hygiene products. Women know what I'm talking about. A lot of people use things they're not supposed to use during their period. Stay clear of them because you don't want infection to go in to your reproductive system. Then, when you're also washing, you should always wash in the backward direction. Okay. Because if you wash forward, you are bringing things from where you pass a waste product into that direction. So you don't want to do that. Now, frequent changing is also very important. We talk about changing because a lot of people say, oh, my flow is not heavy. I use 1 pad per day. That is still not good enough. It's a foreign thing. You shouldn't. The maximum should be 8 hours. And if it's a young lady or a woman that has a heavy flow, you can change as often as you need to change. Right. Now, it's also being advocated that you should not you should not use 2 types of sanitary products, because for a lot of women they have heavy flow. So because of that, you just pack different products. Maybe use 2 or 3 because you have heavy flow. It's been advocated that instead of using that, you should just make sure you change more frequently. Maybe it will be 3 hourly instead of 8 hourly, but don't pack up because that place is going to be hot. You're going to change the whole environment around your private part. All right. Now, another one is that we all know that recently there's been a very high increment in the prices of all these menstrual products. And for a lot of people, you'll be surprised they can afford it. The prices have literally doubled. And some people don't use these common products because they react to them. So what they use is clothes. They cut pieces of clothes for their menses. It is not the best, but for some people, that is what is obtainable. So what we tell them is that they should not use materials that are too tough or thick. Okay. And they should not use any material for more than 3 months. Now, for shaving, a lot of women shave. It is better to trim than shave around the period, not clean shaving. That's another tip to help during the hygiene. Then we talk about pad rash. It's also quite common for some girls. They react to the pads and they have rashes. So the most important thing is to frequently change so that it can stay dry for as long as possible. But sometimes you might require to put some ointment on it to treat it. Now, like I said, it is always better to use 1 type of product as opposed to 2. Sticking to 1. Then, sticking to 1 at a time. You know, I've seen people use like oh, I bleed a lot, so they just use like 3 types at the same time. They can use the sticky one, the thickened one. Some will even use it with tampon. Just pick one. It's just that you have to change it more often than someone that has a regular flow.
All right.
Then
Okay,
I'm listening.
I'm listening.
Another important one is disposal. Disposal is so essential.
All right.
Because we realize that girls that are unable to dispose properly are the ones that miss school or work on their period. So you have to make sure that you don't flush your pad. Toilets are not meant for flushing.
Okay.
If you're going out, you can take a nylon with you, several nylons. When you use, dispose and tie it. You can put it in another compartment in your bag, whether it's school bag or office bag.
Okay.
Then make sure that you always wash your hands afterwards.
Wow.
Then there's something I always say, that period is a visitor that sometimes comes unannounced. So as a girl, as a lady, once you're menstruating, at any point in time, you should have at least one pad in your bag, so that whenever it comes, however it comes, you will be prepared for it.
Wow, really happy.
So
All right, it's like a lot of my questions, you even put them into one answer, because all the questions I have on top. But let me throw these. This one came in from a listener. Is that I'm trying to explain to my little teenage girl what ovulation and menstrual cycle means, but I don't know how best to put it. What is the pointer, please?
Okay. So what happens is that once it's in completion of a puberty step for a young girl, menses is like the final part that says, okay, she has grown, she has pubic hair, she has armpit hair, now she's menstruating, she is capable of reproducing. That's basically what it means. Now, in a woman's cycle, which most commonly we use average of 28 days, but for a lot of people, it can fall between 21 and 35 days.
All right.
So what happens is that every single month after a girl starts period, she ovulates. Ovulation is like, I like to use this analogy, it's like laying egg. Meaning that every month a girl or woman is capable of laying eggs, maybe 1 or 2, as the case may be. And once that process happens, the womb is like, okay, egg is available. It's possible that this egg will become a baby.
Okay.
Once, that is if fertilization takes place. So once there is no pregnancy, this womb that has prepared for this incoming baby has to shed off and say, okay, so this baby did not come this month. All the bed I've made for this baby, all the preparation I've made for this baby is of no use. So the womb, all the layering is what comes out during the period.
Right.
So that is what happens every month for any woman or any young girl that is menstruating. It is a result of ovulation that did not lead to fertilization. Okay. And it is good to say that for a woman, when we say a woman has entered menopause, it simply means she has stopped laying eggs and she has stopped preparing for conception naturally. Yes.
All right. That will take me to the one. One of the questions said, "What are the best way to relieve period cramps?"
Yes. Period cramps are really, really terrible for young girls. It is another reason, or even women, that they miss school or miss work. Like, one of the first things we say is that it's all about education. It's all about education. If your menstrual cramp is more when you're starting your period, so like the first few years is associated with a lot of menstrual cramps. So there's been medical relief and non-medical relief people have spoken about. Some people will tell you that before their period, which is very common for women, they crave sweet things. So, but that craving, sometimes we've noticed that it increases pain that women feel when they're on their period. So, women, you can educate them that when it's near your period, reduce your intake of sugary content, even though you're craving it. So, there are also medications that can be used, which of course I won't be prescribing on radio, but there are medications that can be used that will reduce the menstrual cramp. Some people claim that hot water or even cold compress on their tummy actually relieves them when they are having menstrual cramp. But I also like to use this opportunity to chip in that for some women, that pain that they have during period, especially if you didn't used to have it before and it suddenly starts, it could be a warning that there may be an underlying gynecological problem. So, a lot of times we talk about endometriosis. For some women, it's fibroids. When the fibroids are big and they're in the muscles of the womb, those women, when they are contracting during their period, is really, really bad. Wow. So the few tips I can give the person is to have, one, less sugary intake around the around the time of period. Cold and hot compress has also been said to help some women as well.
Wow, really, really want to appreciate Dr. Lewu. Thank you so much for that eye-opening. My final question is going to look at into guests themselves taking up their period and this issue of menstruation with dignity. What should be your word for guests out there?
I'd like to let them know that they should be proud of their period.
Okay.
It is a natural phenomenon. As a gynecologist, I can tell you that as a parent or as a relative, when you have a 14, 15, 16, 17, 18-year-old that is not menstruating, you will visit all the hospitals in Nigeria looking for why this child is not menstruating. That's for you to know is very important. And another tip is that for us to understand that menses is not a taboo, we have to carry our male colleagues along. You can talk about, you have brothers, you have fathers, you have cousins, you have husbands, you have partners. So it's for everybody. Menses is natural and it is not a taboo.
All right. Thank you so much, Doctor. For people at home, Dr. Abosede is the founder of GuestAid. She's a medical practitioner, a social entrepreneur, a women rights and education advocate. Thank you so much, Dr. Abosede Lewu.
Thanks for having me.
All right. On behalf